Assalamualaikum warahmatullahi wabarakatuh. In this time, I would like to say thank you for watching to my presentation. Today, before I will start my presentation, I want to introduce myself. My name is Artha Novia. I'm a medical student at the University of Bengkulu. The Honorable Mrs. Dr. Wisma Yunita MPD ex English lecturer and all participants who watching this presentation. The title of presentation is soy protein sensitization in cow milk allergy patients. The purpose of the presentation is to explain about an article that has been published and as material for practicing the presentation. Next slide. This article is not mine, but this original article by author Nina Mutiarti, Zakiuddin Munasir, and Alan R. Tumbelaka. This article is sourced from Pediatric Indonesia, volume 47, number 2. Sorry beforehand if I use an old article. This is because I found it on the website, and name of website is Sinta Indonesia, which one in my opinion has been indexed. Next slide. This article is divided into 5 sections, which is the first is background. Background cause milk allergy. CME is one of the most common food allergies in infancy and early childhood. Alternative protein, so for vegetable protein such as soy, can be used as a substitute for cow milk. But in this article, CMA patients were given an extensively hydrolyzed formula to avoid potential sensitization to soy protein. This is because previous studies showed the prevalence of the soy allergy in CME patients ranged between 0 to 63%. Next slide. Number 2 of 5 section, is aim or the purpose. The purpose to determine the proportion of soy protein sensitization in CMA patients and characteristics of CMA patients who were sensitized to soy protein. The next section. In this section we have method. Number 1 of method is in this study use the describe and cross-sectional study. And the number 2, this study carried out at the Department of Child Health Cipto Mangunkusumo Hospital, Jakarta. And this study using a sample of 57 CMA patients. Number 4, estimation of the sample size was calculated use the sample size formula for one proportion. And number 5, cause milk allergy patient or CMA patient who had allergy diagnosed by the previous patient. And number 6, the diagnosis of CME was based on history of allergic manifestation of CME, elimination of provocation tests, and data of immunoglobulin E specific or skin-free test of cold milk. Next slide. In this slide, you can see the result of the method. There are 4 tables. Table number 1 is named Studies on Soy Protein Sensitization and Allergy. You can see there is study, population, and prevalence. And then table number 2 have evaluation of soy-specific immunoglobulin classes. There have class for the soy-specific immunoglobulin E. You can look this one on table 2. You can look level under the table low, moderate, high, very high, and very, very high. And then we have table number 3. In this, we have named characteristic of CMA patient. This we have characteristic about age group, gender, clinical manifestation, family history of atopic disease, family member history of atopic disease, and CMA type. In this, we have the total is 57 and present text about this characteristic. For table number 4, there is a characteristic of CMA patient with soy protein sensitization. This is the main of the article. You can look this table. We have the age, month, and then family history of atopic disease, clinic manifestation of CMA, CMA type, so specific IgE, and immunoglobulin class. On the table number 4, there are the result for the table number 1 and until table number 3. Next slide. We have result. The result, we have 57 CMA patients for the study. Which one? In table 3, the before slide this, we have the 57 CMA patients were enrolled in this study with mean age of 17 months and range between 2 to 6 months. And then for the table number 4, there is a 10 out of 67 CME patients were sensitized to soy protein 70.5%. And then we can see result number 2. The number 2 about the table number 3 and table number 4. We can see the number 1. This 18% of patients show sensitivity to soy protein. And number 2, we can see the 7 of the 10 CMA patients who were sensitive to soy protein were under 12 months old. And we consider many child and many baby have sensitivity to soy protein. And then they have choose milk or cold milk. The next slide. Before we'll to read conclusion, we have discussion, and then allergy reaction in food. Allergy can be divided into the sensitizing phase, the vector phase, and the chronic phase. In the sensitizing phase, there were no allergic symptoms, but the specific immunoglobulin could be allergy detected by skin spray test or specific immunoglobulin E examination. The study only determined soy sensitization by soy-specific immunoglobulin examination without elimination and challenged this with soy protein to prove that the symptoms were still excited because of the soy allergy. For the reason, this study could not describe proportion of soy allergy in CMA patients. But we have the conclusion. 2 points. is proportion of soy antigen in CMA patients in this study was 18%. And number two, soy protein can be used as an alternative for cow milk substitute in CMR patients. Okay, thank you for your attention and you're watching my video of presentation article. If you want source and link this article, you can look this at my description video. Thank you. Assalamualaikum warahmatullahi wabarakatuh.